Welcome to Minding Men. I'm your host, Brian Pollock, and today we have Dr. Jason Nagata. He's a pediatrician and a researcher specializing in adolescent eating disorders at the University of California, San Francisco. He edited the book Eating Disorders in Boys and Men and is senior editor of the Journal of Eating Disorders. He has published over 400 articles in academic journals. His research has been covered by national media, including the New York Times, NBC News, NPR, and CNN. He is the recipient of the American Academy of Pediatrics Emerging Leader in Adolescent Health Award. That's a tongue twister, and the International Association for Adolescent Health Young Professionals Prize. He is nothing to snuff at, and he recently published a new review article we're going to talk about today, Muscle Dysmorphia in Adolescents and Young Adults, published in the Lancet Child and Adolescent Health. Dr. Nagata, thank you for joining Minding Men.
Thanks so much for having me.
Yeah, I've been aware of your work, and we had a brief convo before this. I've been very much aware of your work, and where I teach at a university in Manhattan, we use your work as part of our learning as well for master's level students. It's always focused, it's always clear and precise, and you're always doing such a wonderful job getting a lot of advocacy out for not only males but adolescents. It's really nice to see. So thank you.
Thank you for those kind words and for incorporating it into your coursework.
Yeah. So the article proposes that the new criteria should be published in the DSM pertaining to muscle dysmorphia. And you really outline why and how. And it's a really wonderful article. It's the first one I've ever seen that really is pushing and making this stance. What inspired you and what brought you to this point?
Yeah, thanks. I actually think that I came into this field when I was a student, actually my very first year of medical school, because one of the very first patients that I took care of was a 16-year-old male wrestler who was referred to our eating disorders clinic. And I remember at the time, this was before DSM-5, as a new student who was trying to learn about how to best take care of him, I just recall that there was a huge lack of literature and data, and even the medical guidelines and the DSM at the time was very female centric. And so I think, really showed me how gaps in care and knowledge can really detrimentally affect patient outcomes. And so I'll just tell you a little bit about the patient. He was a 16-year-old male wrestler. His parents had actually brought him in to clinic because even though he didn't think he had a problem, they said he was weighing himself 10 or more times a day. He was completely obsessed with becoming muscular, so he was taking only protein supplements and shakes while cutting carbohydrates and fats. He had varsity wrestling practice 2 to 3 hours a day, but then all of his other free time was spent in the gym. So he often was exercising for 5 or even 7 hours a day. And it really became an obsession. And it led to significant medical consequences. So when he was seen in clinic, he had a low heart rate, low blood pressure, and had several medical complications that actually required him to be hospitalized. And despite, you know, very significant mental health symptoms and physical health consequences, at the time, to be diagnosed with anorexia nervosa, you actually had to have a loss of periods, and that obviously doesn't apply to males. At the time, muscle dysmorphia was not a formal diagnosis. And so I remember that there were just lots of barriers to care for this individual. And then also, even when he was in care, the sort of best practice guidelines were not up to date. And so I think since then, the DSM-5 has come out. Muscle dysmorphia was introduced as a specifier of body dysmorphic disorder. And I think that it has generally increased awareness of some of these body image issues in males, which I think is a step in the right direction. But in this article, I think now that DSM-5 has been around for a little over a decade, I do think that we're still learning that there are still gaps and there's still ways that we can improve care for, especially for these boys and men who are struggling with muscularity issues. And that's sort of the point of this article is, for DSM-6 or sort of going forward, how can we continue to improve these diagnostic criteria so that we can better serve patients who are struggling with these muscle-related body image issues?
And you're seeing an increase in this, is that correct?
Yeah, studies, actually, in particular, one study in Canada found a 400% increase in male eating disorder diagnoses over the last 20 years or so. And I think overall, we are seeing a rise in eating disorder and muscle dysmorphia symptoms. But I do think that, part of the challenge with this is that I still think that there is quite a bit of overlap between eating disorders and muscle dysmorphia. Um, but because of the current criteria, I think um, there's some confusion in the diagnosis, which I think could be better clarified.
Especially for males, there's always confusion in diagnosis of eating disorders. So the more help we can find to look at certain qualifiers and categories, the more we can help people, obviously. And that's a big benchmark of the work you're doing with some of your team. And it's been noted, I can tell you that much. One thing I always wonder is if there was the opportunity to have muscle dysmorphia as an actual, more of a not a specifier, but actually part of an eating disorder. Does that open up funding as well as other opportunities to be able to really push and learn about how to support men who struggle like this?
Yeah, I think that's absolutely right. I think the ultimate goal for this is that if we are able to get a diagnosis that is more understandable, that can, more easily be diagnosed for people, that then opens up the doors, because of, the American healthcare system. Often you need a diagnosis to be eligible or to get insurance to cover certain treatments. And so I do think that it's important that, we get the assessment right and that it allows for the appropriate support. I think that one of the challenges with the diagnosis now is that um, muscle dysmorphia is only a specifier of body dysmorphic disorder. And because it's sort of framed within the body dysmorphic disorder purview primarily rather than an eating disorder. And technically, if you look at the criteria, it does say that, as part of being a type of body dysmorphic disorder, there is a specifier that says that the appearance or weight preoccupation is not better explained by an eating disorder. So it sort of makes muscle dysmorphia mutually exclusive from an eating disorder, which I think leads to some of this confusion because, as I mentioned, many boys and men or anyone with muscle dysmorphia, oftentimes they are engaging in disordered eating behaviors, whether it's protein overconsumption, cutting carbs and fats, or use of muscle building supplements or even drugs.
Mhm.
These are all eating or nutrition related components. And so I think to some extent, many people who have these muscularity concerns engage in some form of disordered eating. But if technically you can't meet criteria for an eating disorder, I think that is where people get put in limbo.
Yes, so we're going to go through that now a little bit to get a little more specific. But one of the things you just said about muscle dysmorphia being in its own kind of category is such a rare occurrence. And maybe you can either tell me I'm crazy or not. I mean, the only way I can see muscle dysmorphia being absolutely, let's say, isolated on its own is if it's connected with something more around an obsessive compulsiveness versus food, which I think is probably more rare and more unique in and of itself. Whereas the contributing factors within this complex web of what's going on, you kind of highlighted, right? Is that the same in young adults as it is in adolescence? How do people kind of show up, or cultural differences, racial minorities? How do we see these contributing factors really playing into a presentation of muscle dysmorphia?
Yeah, I think that's absolutely right. And there are definitely social, cultural uh, risk factors for muscle dysmorphia and some of these muscularity concerns. And so the first one that you mentioned, athletes, we do know, especially for male athletes, in certain sports, there are pressures or advantages to being more muscular, in particularly football, wrestling, rugby. There are certain sports where it just is beneficial to be bigger and it's sort of normalized in the culture. And I do think that appearance and performance enhancing substance or supplement use, whether it's like protein supplements, creatine, or other muscle building products, are quite common. So we do know that certain athletes, particularly those in sports where muscularity is prioritized or privileged, um, are at higher risk. And I guess I should also note that while traditionally it was thought that like sort of competitive athletes, like people on the football team or rugby team, um, were the main culprits, and certainly those populations are at higher risk. And I think there is some work that could be done at the coaching or sort of systems level to help with more awareness and prevention. Another group that, may not actually be competitive athletes, but I do think that like weightlifters, more and more these
Yeah.
days, there are young people who are going to the gym like purely for appearance purposes. They're trying to get jacked or ripped, but they're not necessarily competing in a sport. They're just doing it for appearance purposes. And we also know that, weightlifters or gym goers may be at higher risk for muscle dysmorphia as well, even if there is not an athletic competition component. Um, Other than athletes, we also know that in general, minority groups, whether it's racial minorities or sexual and gender minorities, may be at higher risk also for muscle dysmorphia. I think that for like LGBT youth or sexual and gender minority youth, I guess there's obviously a lot of diversity within the LGBT spectrum, but just breaking it out a little bit, transgender men, for instance, are people who were assigned female sex at birth. So oftentimes they live with these gender norms that are, um, that are promoting muscularity and masculinity, but they are in a, biologically in a female body. And so there's these added pressures, I think, where your biology is sort of contradictory to um, the gender that you identify with. And so there's even added pressures, I think, for muscularity content. And so I think transgender men in particularly have very high rates of muscle dysmorphia, or at least muscle dysmorphia symptoms.
Mm,
And then I think in general, we also know that sort of media and peers play a big role in body image. And there are certain groups, I think, where muscularity is just, more prevalent and more uh, common on even like social media threads. There's lots of fitness and muscularity content these days. And oftentimes sexual and gender minorities do see more of this content. And so they may internalize this more and have greater pressures as well.
yeah. I mean, wow, depth of research you've done on that, and I know you highlight this in very much in the article. It gives some real good examples. Being in the world that we're in, experiencing how people are starting to act on their body. I often say in body image work, we're going from a place of being in our body to now acting on our body to be safe in the world. And that's a big piece of what ends up happening as to with muscle dysmorphia, not feeling as though you're strong enough, big enough, you're weak, you're not capable, you're vulnerable, you're not matching, you're not able to reach certain, let's say, valid points of physical prowess or acceptance. That's just one piece of the co-occurring conditions that happen. Do you see other pieces of co-occurrence with these particular things, such as anxiety, depression, bipolar disorder? Do you see experiences where, let's say, people in certain cultures are anxious just to be a part of it? For example, I know, and I will give a good call out to Gerald Calzo, who does a lot of work in the LGBTQI plus community, where he really talks about how rampant this stuff is, particularly eating disorders, but the connections here. Um, when you enter certain cultures or you are part of a certain culture, and it doesn't match the norm per se, let's say the heteronormative norm, white Anglo-Saxon norm as well. I apologize, but it's the truth of the American standards here at times. There's a piece of needing to find how you fit in, right? So in the LGBTQ community, there's a lot of, let's call it labeling of body types. And having, once somebody discovers who they are, they're kind of moving into being certain body types in order to just kind of be safe and say, this is who I am and who I've become, right? That happens, and I'm going on a tangent. But more importantly, when all of that happens and people are trying to figure it out and trying to take care of themselves and muscle dysmorphia shows up, what co-occurrence, what comorbidities complicate this for them at those moments?
Yeah, I think that there are definitely are mental health comorbidities, and I guess given the current framework of muscle dysmorphia being a type of body dysmorphic disorder, if we take the current DSM-5, then I think probably the most common co-occurrence is actually an eating disorder or disordered eating. As we mentioned, there are many people who are trying to gain muscularity will engage in some sort of disordered eating behavior. So I think that is probably the most common co-occurring issue is some sort of eating disorder or disordered eating behavior. And another behavior that's very common in people with muscle dysmorphia is use of anabolic steroids or other appearance and performance enhancing drugs. So there is also quite a high co-occurrence of substance use and substance use disorders, particularly for anabolic steroids, but also for other substances as well. Um, and then in general, we do see higher rates of depression or anxiety and other mental health conditions. But I would say that probably the two highest co-occurring issues are disordered eating and substance use.
So I'm going to go off the information you're talking about here, and some question I did not think I was going to ask, which is I know this is focused on men and mental health and the work you're doing about boys and young adults, males. Do we see an increase? Are you aware of any increase in this with women as well?
Yeah, I think that that's a great point in that I sort of feel like muscle dysmorphia, colloquially, it used to be even called reverse anorexia. In some ways, I do feel like that's an apt uh, analogy because, in anorexia nervosa, oftentimes the ideal is thinness, and so people are trying to become thin, whereas in muscle dysmorphia, they're trying to become big and muscular. But another analogy to that is I think that the typical stereotype for anorexia nervosa is that it primarily affects girls and women, but we do know that boys and men can also experience anorexia nervosa, even though it's a majority females. And so I think the reverse is true for muscle dysmorphia, that even though majority of patients who experience muscle dysmorphia are boys or men, there are increasing muscularity concerns for girls and women, and certainly girls and women can develop muscle dysmorphia or at least have muscle concerns that can lead to some of these performance enhancing drugs or other substance use. So I do think that there have been pressures for muscularity that have increased for both men and women, boys and girls, but it still is a majority boys and men.
Okay. And I think you've done this research in the past. I remember reading about it. But if we go back to the days of Pope and Olivardia and we look at, let's say the Star Wars figures and that stuff, where we see the difference of Star Wars figures from the 70s to, let's say, early 2000s, and there's a big difference of, let's say, body types and structure to eventual muscularity here in the 2000s, and it's pretty amazing to see. Um, how how much do you find, or have you done research around video games and the influence? There's social media, we can all go down that road, but particularly I'm talking about video games where these characters that people are playing are highly muscular and perfect in the way that they present. Does that have any cross connection for people?
Yeah, I think that's a really important point. And, you know, three of the biggest social influences that we know for body image are the media, peers, and parents and family. And so I think within that media category, that encompasses everything from, yeah, the action figures, Hollywood movies, television, social media, and video games. And I do think that to some extent, these are all overlapping trends.
Mhm.
Like when we look at the Marvel superheroes or whatever, like certainly if you compare the Adam West like Batman and Robin from the 1960s to Batman uh, actors or models and Marvel superheroes who are much more muscular. I think and to some extent like permeate video games. Often video games are based on movies or some of these same franchises, as well as action figures, television. So I do think that there's a lot of overlap, and generally the trends across these platforms have been to portray increased muscularity. But I do think it's an important point that you make that there's been a lot of attention to the sort of traditional social media like TikTok, Instagram, Snapchat. But we do know that in general, girls are higher users of that than boys. Boys are much more likely to engage with video games, and many of them are engaging with video games in a social way, like there's doing multiplayer video games or gaming with their friends. So I think one could argue that actually video gaming is the like prominent form of social media, or it is at least a media that boys use to be social. And I think that the same trends in muscularity apply to the viewers and characters in video games.
It's interesting. I don't know if there's how much research out there. I know you've done a little, but or maybe a lot. I don't know. I wonder if their trends are similar. When you look at, Jonathan Haidt's doing incredible work out there regarding social media influence from around 2010 forward on our general population. And I don't know if there's anybody or any reference for people around how these video games and how they got more intensive and complex has affected men and boys over the years. Any idea?
Yeah, that's definitely an area that I think is important for future. I'm not aware of people who've actually studied the like muscularity trends in video games specifically, but I think that is a very important area to be pursued. One thing that I will mention is that when we look at the more traditional social media, while most attention has been to the girls and young women and impacts on body image, the studies that have been done on boys and men, which are certainly fewer and far between, have shown that boys who engage with Instagram are more likely to have muscularity dissatisfaction, disordered eating behaviors, and even they're more likely to use anabolic steroids. So I do think that even the traditional social media, when we look specifically at the impacts on boys, do reflect some of these muscularity and fitness concerns more so than the thinness and weight loss concerns that are often perpetuated for girls.
So thank you for pointing that out. I just want to point out there might be a slight lagging connection. I don't know if it's on your end or my end. Sometimes there's a little bit of a break in the conversation. So hopefully people listening could get through that. It's not a big deal. You still have the smarts of Jason Nagata here. So for goodness sake, just keep listening. We don't have a lot more time left, but one thing just to kind of get back on track to what we are talking about is you're talking about critical gaps and trying to fill them in this research article about how to understand the treatment of muscle dysmorphia in adolescence. And you give suggestions and ideas, kind of like you just did about social media and gaming, about research directions. What do you think? Where should the research go in order to have the greatest impact to improve outcomes for people who are going through this?
Yeah, that's a really great question, and there's still so much to be done in this field. I do think that the ultimate goal is to get better treatment and better treatment outcomes for people who are suffering from muscle dysmorphia. But I think first to get to that treatment, you really do have to have a appropriate and accurate diagnosis. So I do think that trying to create a diagnostic criteria that is the most useful and relevant for the sort of symptoms and behaviors that people with muscularity concerns are experiencing is the first step. But then once we can kind of settle on a diagnostic criteria that seem to work best in this population, then I do think that having very specific treatment studies and outcomes to study effectiveness and efficacy are so important. We do identify a few articles or studies that are mostly preliminary or pilot studies that have looked at cognitive behavioral therapy or family-based treatments for muscle dysmorphia specifically. But I do think that there is still a lot of work to be done. A lot of those are with very small samples or even just individual cases. And so we do need to better understand uh, how to most successfully treat and support young people with muscle dysmorphia.
And it's getting worse. I have kids and I see the sports they're playing and I see the pressure that they're going through, especially with the culture of how sports are nowadays, as well as the culture of, let's just say, our neighborhood hangout kids and what's being pushed upon them. The idea of travel sports, club sports, the intensity of having to have some kind of prowess and leadership that goes within the idea of masculine ideals continues to permeate very strongly, which can then, of course, go across the line here. So finding the, and what I really love about your article and the work you're doing is saying, hey guys, this is a real deal. We need to pay attention to this. And we need more ways to do the research. So let's get this where it belongs, which is as an actual diagnostic kind of identification, or shall I say, diagnosis within the eating disorder universe, so that we can continue to do this research because there are major gaps. And speaking of that, let's talk about for one moment who is filling those gaps. So we have you, Dr. Jason Nagata, and then you have a bunch of guys. Let's give them a shout out. You have a bunch of guys you work with that you always do good research with. Can you name a few of them?
Yes. Yeah, I think in this field, we're very lucky to have some very smart and interdisciplinary team. So even on this article, we have Dr. Stuart Murray, who is a psychologist at UCLA, Dr. Jason Lavender, also from a psychology background, Dr. Kyle Ganson, who is a social worker at the University of Toronto, who's also done lots of studies in this field, particularly in the Canadian context, as well as Dr. Jinbo He, who is a psychologist in China, who has actually really revolutionized sort of the identification of these issues in Asia and in the Chinese context.
Wonderful. They're all wonderful researchers. And I remember meeting Kyle Ganson at a conference once, and he looked at me and he's like, I think I'm going to actually get my PhD and do research. And he went and he did it, and he's doing great work with it. So it's good to see all of you working together. You're all doing an incredible job, and thank you very, very much. I
Yeah,
know I
thank you so much for.
Yeah, that's what we're here for. I know I personally would not have as strong or as passionate of a career if it wasn't for the work you guys are doing. So I'm just following in your footsteps and you're leading the way. And I look up to you all very, very much. And I hope others do as well within the eating disorder community, within the therapy community, within the regular community to recognize the torch bearing that you're doing. So. Yeah, we look forward to more research coming our way because you write a lot.
Yeah, I think as we've mentioned, this is an ever evolving field, and I think even if we get the muscle dysmorphia diagnosis right for 2025, there's always new risk factors on the horizon. If you think about the last 10 years, how much social media has changed, and now, there's the advent of AI, which I think is a whole nother can of worms. I do think that, these pressures will continue to evolve and we'll need to adapt. Prevention, treatment strategies as they come up, even the early sports specialization trends that you were mentioning in athletics. I think we may continue to see even more of that in the coming years and decades. So this work is always a evolving area, and also grateful for you and everyone who's working in this field to support boys and men get through some of the challenges and struggles uh, of the modern day.
Yeah, I agree. And thank you. I think more importantly, we're all in it together and we're going to make it happen. So thank you, Dr. Jason Nagata. And everyone who's made it this far and is listening, thank you. And please look up Dr. Jason Nagata's research. Read this new article. It's out today, December 3rd. And we are minding men. So please tune back in, and we hopefully will be able to offer more information, more support, and more advocacy for the guys, the men, and the boys in our life, making sure they have find stability, support, and strength so that they can lead healthy, beautiful lives too. I'm Brian Pollock. This is Dr. Jason Nagata, and have a good day.